Hello and welcome to Get Ready, Get Healthy. I'm Doug Spangler, your host. Today we'll be talking about stroke prevention, and as usual at the end of the show we'll give you important phone numbers and websites where you can get more information, so stay with us. Well, a stroke is a serious injury of the nervous system caused by an interruption of blood supply to the brain. It can cause sensory and vision loss, problems with talking and walking, or difficulty in thinking clearly. In many cases, the effects of stroke are irreversible. Stroke is a main cause of adult disability and the third leading cause of death in the United States after heart attacks and cancer. In Contra Costa, it's estimated that 2 deaths a day will occur due to stroke. Around 2,500 Contra Costa residents will suffer a new stroke every year, with another 20,000 living with the devastating effects of stroke. While strokes seem to strike without warning and can occur at any age, there are factors that increase our risk of suffering a stroke. Some we can do nothing about, such as getting older and genetics. Others, however, we can do something about. Controlling high blood pressure, quitting smoking, and losing weight are just a few steps that we can take to help reduce our chances of having a stroke. If we reduced all of our risks, we could prevent up to 80% of strokes in Contra Costa. And that means we can prevent up to 6 strokes and 1 death from stroke every day. Well, to begin our show, we'd like to introduce you to Dr. Ray Stevens. Dr. Stevens is the director of the Primary Stroke Center for the John Muir Health System, and today he'll be providing us with general stroke information. Welcome to the show, Dr. Stevens.
Thank you, Doug.
Good to have you. Let's start at the very beginning. What is a stroke?
Well, stroke is defined as a sudden loss of blood flow to the brain that results in loss of metabolic substrate to the brain and death of the nerve cells. There's 2 major types of stroke. The most common type of stroke is what's called an ischemic stroke. And what that involves usually is a obstruction of blood flow in one of the arteries, usually by a blood clot, either within the artery or coming from elsewhere in the body and traveling up the artery and obstructing the artery, in which case, again, the blood flow is cut off and part of the brain dies. A second type of stroke is called a hemorrhagic stroke, and that is about 20% of strokes overall. It involves an issue where the blood flow, the artery opens up and blood goes out into the brain and again causes brain damage. With either type of stroke, the same mechanism occurs. That is, the blood flow is cut off to the brain and the brain starts to die.
So it's all about the blood going to the brain somehow.
Correct.
So the second one you mentioned was when the artery breaks open and the blood sort of gets into the brain.
That's correct.
Outside of the artery.
So one type is where the blood flow is cut off completely, and the second type is where a blood vessel opens and blood goes into the brain, causing damage that way.
Yeah.
But in both cases, the blood flow is cut off and the brain then dies.
So it's some sort of a problem with the blood flow. Yeah. Okay, that makes sense to me. Now, is it just older people who get strokes, or who can get a stroke?
Well, stroke, of course, is a feature of an aging vascular system. So the majority of patients with a stroke are over the age of 60. However, a stroke can occur at any age range, from neonates through childhood and through young adulthood. In the case of younger patients with stroke, there are different mechanisms that can cause stroke, and we see a higher incidence of cardiac disease causing stroke, congenital heart disease, or acquired heart disease. We see a higher incidence of brain trauma, a higher incidence of infections, especially infections around the brain like meningitis, and we see a higher incidence of drug abuse, sometimes resulting in stroke. So stroke can occur in any age range, and that's the reason it's so important for people to understand what the warning signals for stroke are and how to respond to a stroke when it occurs.
Well, that would actually lead to my next question. What symptoms are we looking at that would actually indicate that somebody is actually having a stroke?
Right. The actual symptoms from a stroke depend upon, of course, where the damage occurs in the brain. But the most common symptoms by far are, one, vision loss, and it can be either vision loss in one eye or in part of both eyes. Second is commonly language deficits, and this can occur with any part of your language, that is slurred speech, trouble with making words, getting words out, and also with understanding spoken language or being able to follow simple commands. The third issue is oftentimes extremity problems, the classic ones being weakness or numbness, usually on one side of the body being affected. So if someone has sudden onset of weakness in the arm and leg, it can be a symptom of a stroke. A fourth issue can sometimes be headache. Headache is not commonly seen in ischemic stroke, but is much more common in hemorrhagic stroke because of buildup of pressure within the brain. So the sudden onset of a headache out of the blue can sometimes be a symptom of a stroke taking place. And the third issue, which is somewhat less common, is sometimes vertigo or sudden loss of balance or coordination.
I would imagine.
Right. All those things can be a symptom of a stroke trying to take place.
Wow, so lots of things could be going on. Vision, balance, affecting the one side of the body in
Right.
terms of being able to move and so on. So it should be fairly obvious for someone who knows what the symptoms are to see if someone's actually having a stroke. What should a person do if they're experiencing these symptoms? Is there something a person could do, or maybe a helper?
Right. The short answer is call 911.
Okay. All right,
and
that's
the
easy.
important issue is the fact that strokes happen very rapidly, and the treatment, as we'll be discussing in just a moment, is based upon time windows. So it's very important that patients get diagnosed quickly, get to the hospital quickly, and have a chance to potentially receive what's called thrombolytic therapy in a rapid fashion. It's also true that oftentimes a patient who's having a stroke doesn't realize it because they're confused or their brain's not working. So it's critical that caregivers, that spouses understand what stroke symptoms are so that they can respond and make sure that patient gets as rapidly as possible to the hospital. Our primary treatment for stroke involves thrombolytic agents, that is what's called TPA, a drug that can dissolve a blood clot and restore normal flow to the brain, thereby preventing a stroke. But it has to be given within 3 hours of stroke onset. So it's very important that you don't waste time by trying to diagnose the case, calling relatives, calling your doctor's office. Instead, call 911 again right away.
Right away, yeah.
We now have treatment up to 3 hours. We have also treatment now through a new European study just became published this year that maybe we can treat people up to 4.5 hours after onset of stroke. And in some cases, we can actually treat people up to 8 hours using these new mechanical clot retrieval devices that can actually pull a clot out of an artery inside the brain.
Wow. So time is of the essence.
Time is of the
really.
essence.
So 911 and as soon as possible. So don't even question it.
Yeah,
Well,
exactly.
what are the disabilities that can actually occur from a stroke for a person?
Well, again, the disabilities will depend upon what part of your brain is involved. But again, the most common things being loss of vision, which can be very disabling in the sense that you can't drive. And in California, not being able to drive is sometimes like being under house arrest.
Exactly, yeah, exactly.
The other issues, of course, is language can be very disabling in the sense that if you can't communicate or get your words out, it can be very frustrating and make it hard for caregivers to take care of you.
Sure.
Third issue being, of course, weakness. If you can't walk, you can't ambulate,
Yes.
that can be a major problem as far as long-term disability. And of course, the cost of stroke, a lot of the cost of stroke has to do not so much with hospital costs, but also with long-term disability costs, rehabilitation costs, and loss of income costs.
Yeah. What about rehabilitation? Because can this be reversed in some way by?
Well, rehabilitation
By treatment?
doesn't actually bring back the brain itself. It doesn't put new brain in the place of dead brain. But it can make a huge difference oftentimes in terms of functional outcomes. And by that I mean, in order for you to be functionally independent, you have to be able to get your clothes on, you have to be able to speak and communicate, you have to be able to get to the bathroom, you have to be able to feed yourself and so forth. So all those things, rehab programs are designed to try to, even the case that you have some residual deficit, some residual weakness or trouble with speech, oftentimes things can be made much better with rehab techniques in order for you to become and remain functionally independent.
Right, and the earlier that we get the treatment on that, probably the better for all of that. Well, Dr. Stevens, thank you for being here. Very interesting information. Appreciate you coming by.
Thank you for having me.
Well, we had the opportunity to speak to a stroke survivor. Well, let's see what he had to say.
High blood pressure is the most significant modifiable risk factor for stroke. Add smoking, overweight, lack of exercise to the list, and your risk increase even more. I'm Victoria Valladares with Contra Costa Health Services, here with Phil Brooks. He's going to be talking to us about stroke and his experience. He's a volunteer with John Muir Medical Center and at the Veterans Affairs Medical Center. Thank you for being here with us, Phil.
My pleasure.
Phil, tell us about your lifestyle before the stroke.
Well, it was rather hectic, a lot of pressure. I had 3 jobs, and I was on the go pretty much 7 days a week.
Did you think that you were at risk for stroke?
No, I had no idea. I didn't even know what the stroke was. There was no history of stroke in my family, and so I didn't even think about it. I didn't give it a second thought.
Tell us what happened the day of your stroke. What symptoms did you have?
It was a normal day. It was a Sunday, and I was on the computer at home emailing a friend of mine. And when I hit send, things changed in a hurry. I noticed that my right hand and fingers were started going numb. It's the same feeling you get when something falls asleep, your leg or your foot or whatever, and then it wakes up. In my case, it didn't. and it started going up my shoulder, my arm, my shoulder, and I'm rubbing it like crazy. And I'm wondering what's going on at the time, and I walked over to around a little bit in the apartment, and nothing was happening. So I sat down on the couch, and I'm rubbing and rubbing and rubbing, and nothing's getting any better. And I thought, okay, I've got to do something. I've got to call somebody. I don't know what to do. So I went to stand up, and I realized that I'd lost the ability to use my right leg. So I fell, and I crawled to the phone. I did not call 911. I was so afraid, I ended up calling my ex-girlfriend, who wasn't home, by the way. And I left her a message, and I lay on the floor and waited for the phone to ring. And several hours later, she called me back.
Why didn't you call 911?
The reason I didn't call 911 is because I was so frightened. I had never had anything like this before, and I was so frightened that I thought this can't be real. It's not happening to me. So I'm going to call somebody who can empathize with me and maybe come over and talk with me a little bit about it as I get better. And I wasn't getting better. She came over and she said, "Phil, you've had a stroke, and I'm going to call 911." And I said, "This is not funny. Would you please help me stand up?" And she said, I'm not joking with you." She said, "I'm calling 911." And thank God she did. Otherwise, I wouldn't have this conversation with you right now.
How long were you hospitalized?
I was here at John Muir for 2 months. And that was just the beginning of my rehab, just the beginning.
How has your life been impacted by stroke?
That's a very good question, because I don't do the things I used to be able to do. I was very active. I was, like I say, in the gym. I used to play tennis. I used to ski. None of those things I can do anymore. But I have found a new passion, and that is to help other stroke survivors, which is why I'm volunteering here and also at the VA, working with stroke survivors.
What advice do you have for our viewers?
Boy, the first thing I'd say is don't have a stroke. Boy, there are a lot of different reasons why you could have a stroke, but the one that got me was high blood pressure. And in looking back on it now, both my parents had high blood pressure, so I should have had a clue, but I didn't. I didn't really give it much credence. But now I do. I have a blood pressure monitor machine that I use pretty much every day and check my blood pressure. My doctor has been at me to do this for the first time I ever saw him after I got out of the hospital. And I do this on a regular basis now.
Thank you very much, Phil.
It's my pleasure. Thank you.
Well, uncontrolled blood pressure and stress are just two risk factors for stroke. To prevent stroke, it's important to know the risks associated with the disease. And that's what we'll discuss next with Dr. Gerhard Heinrich. He's a specialist in internal medicine and practices at the Veterans Affairs Medical Center in Martinez. He leads a group of physicians at the center for rehabilitation and extended care and is on the faculty at UC Davis. Dr. Heinrich is also a member of the Health Work Group of the Advisory Council on Aging, a group that advocates for stroke awareness in our county and who is fundamental in the production of this show. Thank you for joining us, Dr. Heinrich. It's good to have you here.
Glad to be here.
All right. Let's go on and talk about who's at risk of getting a stroke.
Actually, all of us are at risk of getting a stroke, and at all times. In fact, it can occur at any age. And statistics of the Center for Disease Control indicate that up to 25% of strokes occur before the age of 65.
So 75% over 65, 25 before. What in our lives can affect our chances of a stroke? Is there some lifestyle kinds of things that are going on?
Yeah, it is lifestyle and what we call health factors. And health factors are conditions, chronic or acute, that affect our health.
Okay. I understand that some risk factors can't be changed. I think we talked about this earlier. Tell us about those things that cannot be changed.
The risk factors that cannot be changed are our age.
Yes.
So once we
That is
turn
true.
55,
Unless we find the fountain of youth someplace. That's about
Exactly.
it. Yeah.
We're still looking for that.
Yeah.
But those of us who turn 55, every 10 years after that, our risk for stroke actually doubles.
Wow.
So men are more at higher risk for stroke than women. Another risk that we cannot modify is our genes that we inherit from our parents.
So family medical history is basically what we're talking about there.
Very important. And the kind of genes that we're talking about are those that affect, for example, high blood pressure, diabetes, obesity, and our cholesterol levels, and heart disease. Those are the genes that we inherit. And they do have quite an effect on our risk for stroke.
Well, what are some of the risk factors that we really can work on?
We can work on our lifestyles. We can reduce weight. We can eat a balanced diet. We can reduce stress in our environment and around us. Health factors that we can work on are obesity, high blood pressure, diabetes, heart disease. In order to control those factors, we actually need to detect them. And in order to do that, we should get regular tested.
Doctor checkups.
Exactly.
Yeah, that makes a lot of sense.
Yes, so we can detect them. Once we know we have one of those health factors, we need to take control of them. And that is best done in close collaboration with a healthcare provider.
Sure. Now, smoking, I heard smoking is somehow related. Is there something about smoking and stroke?
Yes, smoking increases your risk for stroke about twofold. It also tremendously potentiates other risk factors. For example, if you smoke and you have high blood pressure, your combined risk is much, much higher than either risk alone.
Wow. Well, is it worth working on these things that we can do something about? Is it really worth it, the effort?
Yes, it certainly is. Estimates from experts in the stroke prevention field, they suggest that up to 80% of strokes could be prevented.
Really?
Yes, if we maximized all our risk factors and reduced all that to a minimum. And that means in our county we could prevent 6 strokes a day.
Wow.
And 1 death a day from strokes.
How fast would, if we started working on it, how fast would it actually produce some results in us?
Well, the good news is that as soon as you work on reducing the risk due to health factors, your risk also goes down.
Wow.
It's instant. It's not like a
Wow.
lottery
Yeah.
where you need
I'd think it would
you
take a
gamble,
longer time, yeah.
and the odds are very long.
Yeah.
You get instant reward.
Wow. Well, Dr. Heinrich, thank you very much for coming by and visiting with us.
It's been a
great
pleasure.
information. Now that we have a better idea of the risk, let's see what we need to do if we think someone's experiencing a medical emergency like a stroke. Take a look.
From the time we were very young, we were taught to call 911 during a major emergency. Just like a fire or a landslide, strokes and heart attacks are medical emergencies too that require immediate assistance. If you suspect that you or someone you know is having a stroke, a heart attack, or another medical emergency, don't hesitate to call 911. I'm Victoria Valladares with Contra Costa Health Services, and I'm with Dr. Joe Barger, Medical Director with Contra Costa Emergency Medical Services. Dr. Barger, what is a medical emergency?
When we're talking about medical emergencies, we're talking about situations that are, if not treated within a matter of minutes or hours, can lead to permanent disability or death. Issues such as heart attacks, cardiac arrest, or even chest pain, problems with lung function, shortness of breath, problems with loss of consciousness, seizures, stroke, poisoning or overdose are all emergencies. Traumatic emergencies that include bleeding or car accidents or major burns are also examples of emergency.
Why is it important to call 911 during a medical emergency? How does that help?
When you call 911, you're going to get instantaneous help within minutes. A lot of times patients will call their family member, they will call a neighbor for help, and that just ends up delaying the issue. In these situations, seconds or minutes can count. When 911 is called, fire department and ambulance personnel can respond rapidly to the scene. They can provide life-saving interventions such as CPR oxygen, the ability to shock a person or defibrillate. They can also stop bleeding, provide first aid, and then later on they can provide medications to help with heart problems, with breathing problems, and with painful situations. As well, when you call 911, a dispatcher can help the caller work through a problem so that if they don't know CPR, they can actually help them provide CPR. If they don't know how to deal with choking, they can help them with choking. In the case of a stroke, we're talking about patients having severe disabilities or death from stroke. So the ability to walk, the ability to talk or to communicate with people is very much at risk here. And so we're trying to get these patients rapidly to the emergency department. And calling 911 is that very best first step.
What are some of the signs and symptoms that indicate someone's having a medical emergency?
Signs of emergency can include shortness of breath, choking, loss of consciousness, uncontrolled bleeding. They can also include onset of severe pain. The symptoms of heart attack and stroke are the most important to know. In stroke, there are 5 key areas that we talk about, and the key here is that they all have sudden or nearly instantaneous onset. When we talk about stroke, the first symptom that we usually talk about is sudden onset of weakness or numbness in a part of the body, either the face, the arm, the leg, or a combination of all 3 of those. Generally, it's more significant if it's on one side of the body. A second type of symptom is a sudden onset of confusion, difficulty speaking, or even difficulty being able to understand another person. Sudden onset of loss of vision in one or both eyes is a third area. The sudden onset of difficulty with walking, loss of balance, a loss of coordination can be an issue. The last symptom is sudden onset of a headache that doesn't have another explanation.
Why is it important to get to a hospital right away?
In the case of a stroke, we have a very narrow window of opportunity. There's about 3 hours in which we can act. We need to assess whether the patient has bleeding, and then we need to give drugs to help deal with this problem. In the case of a heart attack, there are specialized interventions that we can do, such as cardiac catheterization, where we open up a blood vessel or remove a clot that help deal with the problem, or we can give clot-busting drugs to help. And those interventions need to be done rapidly. The best results happen when this occurs within 1 to 2 hours.
Thank you, Dr. Barger.
You're welcome.
Remember, it's critical to call 911 if you suspect someone is having a stroke, and it could mean the difference between permanent disability and a normal life. But it's much better to prevent a stroke altogether. Well, our next guest here, Ann Zuma, is the Vice President of the Stroke Support Group of Contra Costa. She provides stroke education to senior centers, community-based organizations, and other community groups. Ann is also a member of the Health Work Group of the Advisory Council on Aging. Also here is Cynthia Miller, Stroke Program Coordinator with John Muir Health. She oversees the certified stroke programs at John Muir Walnut Creek and John Muir Concord, which involves monitoring for quality of stroke care. Welcome to the show, ladies. Wonderful to have you here. Is a stroke preventable? Let me just ask that right off the bat.
Well, I think from what we've been hearing so far, yes, the answer is yes. Yes, strokes can be preventable. 80%, I think, can be prevented. But that does take thinking about risk factors and making choices, changes, healthy changes in our lifestyle. And I think we're very fortunate in our community to have a lot of options to be able to do that. I don't know, Ann, what would you say?
I think, too, it's very important for people who have already had a stroke to pay very close attention to modifiable risks, because they have a much higher chance of having another stroke or a TIA, which is a mini stroke, which is a warning stroke, if you will.
So modifiable behavior is what you said. So that means, to me, some small change that we can make in our lifestyle. What can the viewers do to help? Small changes to help prevent a stroke?
Well, think about, first of all, do you have any risk factors? We've mentioned high blood pressure, diabetes, being overweight, cigarette smoking, heart disease. Thinking about those, whether or not you have a family history. Did anybody that you remember from your past die from or have any of these conditions? Once you become aware, I think awareness is very, very important, because then you can make some decisions on what you want to do to modify, to make changes and choices.
Yes, and also, in addition to pre-existing conditions like blood pressure and so forth, it's also changing to more positive lifestyles. Your diet, getting more exercise, in the diet taking lower sodium, lower fat content, and eating more vegetables and fruits, and then exercising more. We're very fortunate in the county to have good sport and exercise programs, as well as great hiking and walking trails where we can get our exercise.
You know, I keep hearing about high blood pressure as being a big key here. What can viewers do really to control high blood pressure?
Well, first, know your numbers. I think talking with your doctor about what numbers you should be looking for. Taking advantage of free screenings. There are a lot of free screenings in our community, whether it's your senior services.
Right, I see those things at the grocery stores where you check the stuff like that. Yeah,
exactly.
yeah,
But then
yeah.
what do you do
Yeah.
when you find out the numbers? So finding out from your
So,
doctor, do you want to be less than 130 over 90, or do you want to be less than 120 over
And
80?
that changes with your age too, doesn't it?
Yes, it does.
yeah.
And as you get older, it probably gets higher. It's difficult to control, so sometimes it's diet and exercise. Medications quite often are necessary.
Now, you talked about good nutrition. How does that actually affect a stroke? Eating right. How does that affect it? I don't understand.
Well, by lowering your salt, that helps to keep your blood pressure lower.
Oh, there's a connection there.
Yes, and then lowering fat keeps your cholesterol in control.
I see.
And sugar will help, lowering your sugars will help prevent diabetes. And then, of course, increasing the number of fruits and vegetables you eat every day leads to a healthier lifestyle.
I see. Interesting. Well, here's a question for you, Ann. What programs are there available in the community to help people to educate themselves or to go for support or whatever?
I think we're very fortunate in Contra Costa County. Many of the towns and cities have park and recreation departments which have programs for people of all ages. We have senior centers as well as churches where they do various testing for blood pressure, cholesterol, diabetes. They also have programs to teach proper nutrition, diet, exercise, and then and many of these activities are announced in the weekly local sections of the Contra Costa Times, so you can find out where they are and when they're going to be held. And then spring through fall, we have a lot of family and senior health fairs where testing is done, as well as information given out about controlling risks for stroke, heart attack, and other medical conditions, and then also giving you information on how to promote a healthy lifestyle.
I would imagine the HMOs in the area and the various hospitals have programs as well. That's just my guess.
Yes, they definitely
You'd go on
do.
with that, yeah.
One thing that I did want to mention is I know in today's tough economic times, people will be afraid that they can't afford their medications. Never stop a medication before talking with your doctor.
Yes, right, good point.
There are programs that can assist people with paying for their medications, and finding out about those so that they can stay on their medicines is very important.
Excellent. Well, Cynthia Ann, thank you very much for stopping by and bringing us this invaluable information. Appreciate you coming by.
Thank you.
Thank you.
Well, we've run out of time, but we want to leave you with some phone numbers and websites where you can get more information. Remember, reducing your risk factors works immediately, so start working on your stroke prevention program today. Well, John Muir Health has a website where you can get information about stroke, stroke prevention, warning signs, and treatment options. You can access the website by logging in to johnmuirhealth.com/stroke. Once again, that's johnmuirhealth.com/stroke. The American Stroke Association focuses on reducing disability and death from stroke through research, education, fundraising, and advocacy. You can request a free stroke information packet that includes postcards with information to help you recognize the signs of a stroke. To reach the American Stroke Association, call 1-888-478-7653. Again, that's 1-888, toll-free, 4-STROKE. Well, the Centers for Disease Control and Prevention has a website also dedicated to stroke prevention. Their website can provide you with an array of information on stroke prevention, risk factors, and stroke facts, and even more. Also, the CDC website is www.cdc.gov/stroke. That's www.cdc/stroke. And we encourage you to contact us with your thoughts and comments. We're always glad to hear from you. Our number is 925-313-6817, or visit our website at cchealth.org. Well, thanks for joining us, and we'll see you next time on Get Ready, Get Healthy. Bye-bye.